So I got a great question from someone in our LinkedIn group named Michelle. If you haven't joined our free LinkedIn group, it's a really good group, and I'll answer a lot of treatment questions and any other things you need, communicating to the client and just helping you along that journey to switch from becoming that service provider to that solutions provider. Those of you that don't know me, my name is Dr. Matt Maggio. I'm the creator of the Peak Method and the founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that allows them to easily double their income, all while working 50% less and being taken seriously as a healthcare provider. So here's a question. I actually wrote it down. I have a client who has some knee pain. My problem is he hasn't had it checked out by a doctor. I'm asking all of the questions, but his answers are vague. I'm assuming pulling teeth would be easier. So client describes it as pain inside of the knee and happens when he overextends the knee. Muscles, I feel, tight. Vastus Lateralis and Vastus Medialis. Attachment for the glutes, especially gluteus medius and Adductor Longus. When he first came in, it was for the knee on the right leg and the left foot. His cuboid and fifth metatarsal were broken. Any suggestions would be greatly appreciated. Thank you in advance. Thanks for sending that in, Michelle. So I'm gonna break this down a little bit. First off, details matter. And you see this a lot. I find this with massage therapists, especially, that I coach and train, is they're kind of stuck in that service provider mentality instead of that solutions provider. And they kind of take a back seat to other practitioners, especially doctors, chiropractors, physical therapists, and everyone else out there. She even said in the question, my problem is he hasn't got it checked out by a doctor. In all honesty, most of those doctors that I just mentioned, chiro, PT, and orthopedic surgeon, don't have a clue about what's going on anyway. So don't be subservient to those practitioners. But the details matter. A lot of times your clients are just so used to jumping right into treatment. Get on the table and let's go. You might be lucky if you're able to do a 5-minute quick consult before that and not really get a lot of details. And getting your idea and wrapping your mind around the idea of becoming that solutions provider and explaining to the client why you're asking. A lot of times you're going to see this, especially with male clients, is they're going to be a little bit combative, they don't really want to answer questions. But if you explain to them why you're asking the question, so you can get in there and really figure out what's going on, because I always say, how the hell can you fix a problem if you don't know what it is in the first place? And we teach this a lot, even in our free training. We just revamped that. So if you want to get a copy of that, there's links in wherever you're consuming this. And basically what we do is we get in there and teach you how to effectively ask the right type of questions to the clients. I have 7 questions that I always ask. And then we also break down where that problem could be: a bone, cartilage, disc, ligament, nerve entrapment, soft tissue problem, or a tendon. So getting your clients around the idea of hey, I'm asking these questions for a reason because I need to figure out what's going on with you. So knee pain itself is tough. I don't like treating knees as much because there's so many factors that go in there. So my number one factor when I'm looking at a knee problem is, was there trauma or was there not? And when there's trauma and they have a local knee problem, I'm like, okay, this is probably a structural problem inside the knee itself. When there's no direct trauma, usually what happens is that knee is getting overloaded from something above it, something below it, or a combination of both of this. What I think happened with this client with the broken foot is it altered his mechanics and his gait. And especially what happens when that happens is you have your deep muscles back in your calf. They're called your dorsiflexors. And there's 3 primary muscles. Basically, dorsiflexion allows your knee to kind of glide over itself. You need it for walking, for jumping, for sprinting, for moving. And the muscles that get really beat up and they develop some scar tissue are the flexor hallucis longus, flexor digitorum longus, and tibialis posterior. And what happens is when those muscles, they tighten up and they create what's called protective tension. And that protective tension kind of tries to unload that damaged area in the foot. And essentially what happens over time is those muscles develop scar tissue, and muscles are on all the time. They don't get enough blood flow. They don't get enough oxygen, which in turn makes them weaker and makes them less flexible, which can cause problems itself in there, and they build up. But I think what happened for this client was the foot was there. Then you also need to look above the knee. And a lot of times I find a lot of dysfunction, particularly in the posterior chain. There's problems in there, and those glute attachments that you're actually feeling are probably more of a sciatic nerve type of entrapment. So sciatic nerve makes its way from the base of the spine and works all the way down. And nerves are built with like 15% of like extra slack to keep them healthy. Scar tissue forms in those deep muscles in the hip. It's not the piriformis, it's usually like the superior gemellus. And what happens is that nerve gets stuck there and then it starts to pull, which in turn then the hamstrings tighten up to protect that area. Now the hamstrings can't do their normal job, which is to stabilize the knee from the posterior. So in turn, what it does is it puts a lot more pressure on the quads, which would explain the tightness that you're feeling in vastus lateralis, vastus medialis. I bet rectus femoris is a rec as well. Now, I don't like to use words like tight. Tight don't really tell me anything. I always want a tissue-specific problem, and that breaks down to bone, cartilage, disc, ligament, nerve, soft tissue. So what's probably more going on is there's a lot of scar tissue in the rectus femoris and around there as well. So you always got to ask yourself that question, why is it tight? And what happens is it's this thing called protective tension. The body unloads that. So what's happening with this client is I think they had a foot break, altered their mechanics, those muscles develop that scar tissue, which in turn puts the pressure on the knee. So now the client's like, my knee hurts. And another thing that I think was bad on this one was extension hurts. Extension is usually a very positive test for some type of cartilage damage in the knee as well. So then what happens over time is when you have, say your knee's in the middle here and above you have the hips and the hamstrings and the quads that are bad, down below you have the dorsiflexors, which are bad. The knee starts to like slide and grind on itself, which in turn puts more pressure on that meniscus and you get some of that tearing in there as well. So knees are tough because there's so many components in there and a lot of times people don't want to load management. So take homes here are let your client know why you're asking the questions, learn how to ask the right questions, take that lead role as like becoming that solutions provider and knowing exactly what's going on and letting them know what you can do to help. So thank you so much, Michelle, for sending that question in. I hope this helps. And like I said, if you haven't joined any of our free groups or listened to our podcast or grabbed our free training, it's all out there. It really gives you a glimpse into my whole method, the peak method, and how we really start from figuring out what the problem is, having a functional based assessment, and then getting in there and being able to restore range of motion, quality of tissue with dedicated and focused hands-on soft tissue treatment. Go in there, join our groups, do all that stuff. And if you have any questions, send them my way. I'm always here to help. And thanks again, Michelle, for sending that in. Bye.